In today's video, I'm going to show you how to lift your face with osteopathic massage in just 15 minutes a day. Our bones, like muscles and skin, are able to regenerate. Bone cells actively divide if there is a load on the bone. After all, if we lose a tooth, the bone, namely our gum, begins to deteriorate in this place, so that there is no resorption bone tissue and the bone is not destroyed. We need to put pressure and load on it with osteopathic massage on a regular basis. This massage can be done every other day. Just allow 1 day for recovery. And please don't use any oil. Step 1. At the same time, pull your shoulder down and tilt your head to the side. Stretch the lateral surface of your neck. This type of stretch is a very important part of any massage. Step 2. Interlace your fingers and stretch the back of your neck. This is very beneficial and feels pleasant. Step 3. So first work with the angle of the jaw. When you are young, it's angle 90 or around 100% of degree. And as you get older, it becomes more obtuse or even obliterated. That's why it's called the youth angle. Always use a table when performing an osteopathic massage. Since we are working with the bones of the skull, we need additional load and accordingly support for the elbows. We put our thumbs on the lower jaw, elbows on the table, or at least on your body. And we apply pressure. We move all the way down the lower jaw. Apply special pressure to the angle of the jaw. In this way. Let me show you on the skull. You should know that after 40 years, the face ages not only because the skin loses elasticity, but also because of the aging of the bones of the skull. The volume of the jaw decreases and it just goes backwards, and our excess tissues has nowhere to go and it starts to sag. Step 4. We make our lips inward to stretch the muscles and put pressure on the outer edge of the bone. Apply pressure with a 9 out of 10. Don't worry, your bone won't break. It's just gonna hurt a little bit. You have no idea how much tension we have on our bones. That's why it will hurt. But it's only the first time. And as I told you before, when the volume of the jaw decreases and it just goes backwards and our excess tissues has nowhere to go and it starts to sag, we get those sagging jaws, double chin, and so on. And this is where even expensive cream or serum and cosmetician are powerless. That's why it's so important to constantly load the bones of the skull with the help of massage and do not let them rest. And of course, it's very important to take care of the health of the teeth. The absence of even one tooth can give a significant change in our bone structure. Step 5. Here we have the stylohyoid muscle, which tightens and spasms and shortens and pulls the jaw back. Our muscles have nowhere to go, and that's where the sagging jaws form. Place your fingers just inside, in this way. From the inside of the angle of the jaw, and as if stretching the lower jaw, at the same time creating a vibration. Step 6. Now we are going to restore the zygomatic bone. As we age, it goes inward, shifts to the center, and loses its density. This causes the face to become flat. The soft tissues has nothing to hold on to, and our muscles, especially cheeks, sag. We need to work on this area. Make sure you put your elbows on the table and tilt your head. Put your face on your knuckles and apply pressure. The more pressure, the better. I would say 10 out of 10. Don't worry, your bones won't break. That's the power of osteopathic massage. Step 7. Grab and clamp the lower jaw with these hooks and start to rock it. Swing it in a circular motions in this way. Clamp your jaw tightly like a vise. Remember, you are working with the periosteum. The motions are deep. Step 8, I think. Place your fingers on the upper jaw above the teeth and create a load here. This upper jaw is called the maxilla. As we age, the bone there becomes loose. The bone density decreases, it falls inward, and the face becomes flat. When we work on the bone density is restored. Of course, it doesn't happen all at once in one, but slowly, millimeter by millimeter, and the face becomes more youthful, and I would say full. Step 9. Now we move a little bit to the periphery. Here we have the canine fossa. You can feel it, which also becomes larger and deeper with age. By restoring the bone in this area, we will reduce the nasolabial folds. Step 10. Next, we are going to work on this segment of the mandible, right here at the junction. You will feel the dimple right here. Okay, with your knuckles, we make pressure. Tilt your head down. And create pressure and slide slowly to the ears. Do that a few times. And as I told you before, it will be more effective if you put your elbows on the table. And the last step. This is where the eye socket is located. Due to age-related bone resorption, the bones become thinner, more fragile, and the eye socket enlarges. The eyes sink inward, excess skin appears, the upper eyelid droops, and the skin becomes loose. That's why it's very important to put some load on the orbital bone. You should feel the bone. To prevent your fingers from slipping, you need a support, for example, a table, or your own body, like I'm doing. And by the way, I want to tell you that my age-related bone resorption start from temporal area. I recently observed that my temples go inward. So I try to make this osteopathic massage at least 3 times a week, because it's very important. I do hope you enjoy this massage. Take care and bye for now.